all making up for lost time. I'm now able to spend time with my family. I feel like, we're kind of all making up for lost time. I'm now able to spend time with my family. I wasn't able to see or spend time with my brother, sister, father.
We went to the movies like a few weeks ago.
Ashley and I went to a movie. Haven't been to a movie for a year and a half. That was exciting to be able to do that.
Spending time with family and actually hugging people. I'm a big hugger, so.
Both me and my husband have high-risk conditions, and my son does too. We stayed home most of last year. We jumped at the chance to get the vaccine. It allowed us freedom. I was able to go see my dad. The only one who wasn't vaccinated is my daughter, and her age group hasn't come up yet. But we were finally able to see my dad.
I wanted to travel. I'm just a big travel guy. I love to travel. Me and my dad goes little vacations, big vacations.
The things I'm doing now that I couldn't do before is like hang out with my friends.
We are excited that we can start going out and being with our dinner group and different things of that nature.
It's a family tradition, but we always go down and see my other relatives down south in Georgia. Back to last July since August, so we're planning that. So I'm planning 2 trips this summer.
Working out was the big. I had to stop working out for like a year because I wasn't vaccinated. So getting back into that was really nice.
Be inside for church. We've had church in the parking lot for a long time, so being able to be inside.
And I'm going back to dancing more.
On a personal note, I'm happy to tell you that the cruise industry has finally brokered a deal and we can start cruising again. And my partner and I will be on a cruise in September. So I'm very much looking forward to it. I like to be a world traveler.
Concerts for sure. I mean, all these concerts are coming back and popping back up, and there's a ton of country artists that Mom and I like. So we're pricking up to the idea of going out more and concerts and stuff.
And I guess I would say the one thing we're looking forward to is we've planned a train trip around the country. We've also got a trip planned to go to Chicago on the train, and we're taking Ashley and some of her friends.
I would like to go to Great Wolf Lodge. We went there a couple years ago as a family, and my family loved it. But, we have not felt safe doing that. And I would like to go Great Wolf Lodge, and who knows, maybe we'll get to Disneyland one day.
Getting back out and doing things was I was like a kid on Christmas, just being able to get back out and hang out with people and it's great.
Welcome and thank you today for joining us. If you've expected to arrive at the COVID-19 vaccines and Hoosiers with Disabilities webinar, you're in the right place. My name is Matt Norris. I'm joining you today from Bloomington, Indiana at the Indiana Institute on Disability and Community. And I'm going to serve as your moderator today. And I just wanted to do some housekeeping tasks, first of all, to let you know some of the accessibility features that we have available today during our webinar. As you can see, we have an American Sign Language interpreter who is joining us today and will be spotlighted throughout the webinar. We also have captioning being provided today that you can access through the Zoom interface by just clicking on the live transcript or the CC button at the bottom of your screen to your right. I just wanted to let you know that our webinar today is being recorded and will be available in the future for viewing. You can go back and view it again, or you can certainly refer your family, friends, and those who might be interested to the webinar. And also during the webinar, we will have the question and answer feature available. We will be taking questions throughout the webinar. We certainly received a lot of questions for Dr. Weaver today. And so hopefully we'll be able to get to most of those, but feel free to put in questions that you might have as the webinar progresses. And we will see what we can do about getting to them. We only will be on our webinar until 3 p.m., but we'll try to get as many answered during that time. And at this time, I would like to welcome Jae-Chul Lee from the Center for Health Equity to kind of give us a little background about the COVID-19 vaccination project that we're doing here at the Institute.
Thanks, Matt. Hello, everyone. I'm Jae-Chul Lee, Director of Center for Health Equity at the Indiana Institute on Disability and Community here at IU Bloomington. We are very excited to have you all here today. So thank you for being here, including wonderful panelists representing the Indiana Department of Health and disability community. I think we all know that people with disabilities are one of the most vulnerable populations for health disparities, but the COVID-19 pandemic has made this disparity more visible and stand out. The existing research show that it is really critical to get people with disabilities and their caregivers fully vaccinated as soon as possible, because people with disabilities at a great risk for COVID-19 diagnosis and mortality. So how to address? To increase the vaccination rates of Hoosiers with disabilities and their caregivers, our institute and Center for Health Equity have been working on 2 projects since April this year about COVID-19 vaccination. One project will end this month, but another project will continue through September next year, 2022. With this longer project, we aim to educate the importance of receiving COVID-19 vaccine and dispel myth about COVID-19 and vaccines. Specifically in this project, we have been working on multiple activities. For instance, we have created resource web pages about Indiana COVID-19 vaccination, both in English and Spanish version. We have been working a little bit more. We also have developed informational material in English and Spanish, and also video clips. You already got some glimpse of the videos, and we are promoting COVID-19 vaccine-related news and information through our social media. Obviously, this webinar is also one of our efforts. I think you will get to know a bit more the details of some of these activities probably later this webinar. We really hope this webinar will help boost vaccine confidence among Hoosiers with disabilities and caregivers. By the way, today is 31st anniversary of Americans with Disability ADA. My colleague Matt Norris moderating this webinar. He's an expert in ADA, so he will talk a little bit about this ADA and its implications. Matt, I will turn it over to you.
Great, thank you. Yes, as Jae-Chul mentioned, today we are celebrating July 26th, the anniversary of the Americans with Disabilities Act, the premier federal civil rights law for people with disabilities. And I just would like to take a moment to talk about some of the things that the ADA National Network are doing that I think really speak to the commemorating the anniversary of the ADA. And first of all, their theme this year is celebrate, learn, and share. And so celebrating, I think we could, this is a great way to commemorate the anniversary by meeting here today and not only celebrating and recognizing this anniversary date, 31 years of the Americans with Disabilities Act, but also we are getting together to learn about, in this case, COVID-19, and certainly, as Jae-Chul mentioned, the impact on the community life for people with disabilities. And I think that's what's important to remember today as we commemorate the Americans with Disabilities Act. And part of that theme, celebrate, learn, share. I think today we will be having some great stories that we have a couple of disability advocates who will be sharing their vaccination story with us today. As we entered into the webinar, you got to see kind of a preview of a couple of the videos that we will have available that we will share with you how you can find out more about those videos later on in the webinar. At this time, I would like to just express our appreciation, our gratitude for Dr. Lindsay Weaver, the Chief Medical Officer for the Indiana Department of Health, for joining us today. She will become later on in our program. But right now, I would like to go ahead and lead us into the next part of our session here. And would like to thank Melody from Indianapolis and Linda from Muncie for agreeing to be part of the webinar today. Both Melody and Linda have been great in sharing their story about how they got vaccinated and why. And we just thought it was a great opportunity for them to come here today and share that story with you. And my colleague from the Center for Health Equity, Peggy Holtz, will be joining us today to kind of walk us through this. And I'm going to turn off, yes.
Thank you, Matt and Melody and Linda. I want to thank you for joining us today and sharing your story on getting the vaccine. And so to just sort of start things off, why don't we talk about why you decided to get the vaccine? And I'll start with Melody.
I decided to get the vaccine because last year we was in this building. I live in assisted living, and when they closed us down in March. We weren't able to really get out until this March, and I decided I did not want to sit here another year with just holding my hands. I wanted to be with family. I wanted to be able to go on vacation. I wanted to be able to do just a whole lot of things that I didn't get to do last year. So yeah, that was, and when it came, I was ready to do it. Yes.
So if you're assisted living, they pretty much shut everything down.
Mm-hmm. Yeah, everything was shut down. I mean, the week that it happened, everything just shut down, and we weren't able to go nowhere but to do anything. Literally wasn't even able to see our family. It was just like boom, boom, boom. And in November, for whatever reason, they let us out. They opened the doors up for 2 whole days, and we all went like just running, shopping in our kids and in our cars and stuff. But then the end of that day, by the end of the second day, they shut us right down again. And when I say shut down, we were literally shut down. We were literally shut down. The holidays and everything, we can't do nothing at all.
So you were pretty much isolated during that time.
Yeah, you could go outside, but you was not supposed to leave the ground at all. For nothing at all, no one. Out of the apartment, you couldn't leave the building at all. Nothing.
I can see where that would be very depressing.
It was hard. I think a lot of people they didn't go crazy, but I think if they would have waited till now, I think they would have had a war on their hands. But it was. I mean, you did the same thing every day, over and over and over. Yeah.
Well, thank you, Melody. Linda, why did you decide to get the vaccine?
I decided to get the vaccine because I had learned there was a neurological component to the COVID, potentially getting COVID, and I have cerebral palsy. I also have diabetes and high blood pressure. So all those factors, I knew that if I had COVID, there was a pretty good chance I wouldn't survive. And I also got the vaccine because I have personal attendants that come in here daily, twice a day to assist me. And I was getting frustrated with how many of them were coming in and telling me that they had been off work for days because they had the COVID. And the agencies don't even let the clients know when a staff's come down with COVID for them to get tested. So I got tested as soon as I possibly could.
So,
I mean, I got my vaccination as soon as I could.
right. Did that relieve some of your anxiety about people coming into your home who may be vaccinated or not vaccinated? I mean, once you got the vaccine?
Well, I do make them wear their mask whenever they come in here. And then, with the Delta variant, that's made me a little nervous again. So, I feel a little bit more confident because I feel like I'm less likely to die because of the fact that I've had the vaccine. I'm less likely to die if I were to catch the virus.
Okay, thank you. So Linda, and you really wanted the vaccine, but in the beginning, did you have any concerns or worries about the vaccine? And if so, how did you relieve those concerns?
Well, I didn't have any concerns because I had asked my doctor whether there would be an issue for me getting it. He said no. Plus, I know that they've been studying SARS infections for a while, and this was just perfected for this particular virus. So this has been studied. These type of viruses have been studied longer than people think. So I wasn't worried about getting the vaccine at all.
Well, I can tell you were very proactive. I was just wondering if the agency where your home health, did they provide any information on the vaccines?
Oh no, I did the background on my own.
Okay. How about you, Melody? Did you have any concerns or worries about getting the vaccine?
You know what? I thought about it maybe a day or two, but I knew that was my only chance of being able to have more of a summer and more activities, more of a year. I mean, last year was really tough and rough for me. I can sit here and tell you the whole story, but I won't. But last year was rough. Not just because I couldn't get out and have fun and sit down and I lost two people that I love most because of the COVID. And one of them I did get to see. It's rough. It's hard. So I would wish this on no one. I would wish that pain and that suffering on no one. And when the opportunity came, even if I wasn't gonna get to do anything this summer or go nowhere, I think I still would have been glad to get the vaccine because seeing your loved ones like that, it's so fun. Yeah.
Yeah, I'm sorry for your loss. I know that this has been a very tough year for you, and I thank you for sharing that information with
You're
us.
welcome. No problem.
Why don't we talk a little bit about the whole experience of getting your vaccine, as far as, now I know you live in an assisted living, Melody, so did they help with getting the vaccine, and what was that like?
That was pretty good, Peggy. I never seen it before. They turned the second floor into like a New Year's Eve party. And they are inside this building. There are 6 floors, first floor, second floor, and third floor. So they call each of us by floors. So I didn't have to go up to about 1 o'clock. But when I walked down, all the elevator and walked out, it was really beautiful. I mean, even some of the staff was dressed up and they looked like a New Year's party. And they was so kind, and people just came in and talked to us. It was so nice. And then we did the first one, I think it was the second week of January. So when I knew anything, I had heard about it on TV, I had listened to the news and I heard it, and I'm like, okay. The next day, I know somebody was knocking on my door, talking about you want to get the vaccine. I thought it would come out to about April or May. You know, I'm thinking, okay. But like I said, they come knocking on my door and say, Bill, you get the vaccine? And I had talked to a couple of people here, and I had talked to a couple of people at my job, and they said, Bill, it's the best thing for you. And like I said, after I see my loved one sick, I don't know, I don't want to go through that. So like I said, yeah, I jumped at the opportunity to get that vaccine, yes.
Okay, so that's great. So assisted living, they really made a party out of it. I'm sure that helped.
Yes, it did, it did. And they, yep.
I'm sure that helped ease some anxieties that people might have had about the shot.
I think it did too. I really think it did, yes.
And Linda, what was your experience like?
Yeah, mine was a little bit unique because of my proactiveness. I had talked to one of my attendants. She had a phone number of somebody that was actually giving the vaccines from the hospital at their pharmacy. And I contacted them, and I also let them know that I had asthma. I don't think I mentioned that in my list a little bit ago, but I let them know about all my health issues. And they asked me, they said, are you over 60? And I said, yeah. And they said, well, you get to be put on a wait list. And I told them, because of the fact that I couldn't prearrange my ride, I wasn't sure how I was going to do that. But a couple of days later, I went through the door that you go through to kind of wait to be called up to get your shot. And I actually waited till the end of that hour or whatever, because it was close to the end of the day, and they had somebody that hadn't came in, so they went ahead and gave me my first shot, and they scheduled my second shot. So I had my shots done by the end of February.
So yes, you were very proactive in getting your vaccine. I think we are already running out of time. But I wanted to say thank you to both Melody and Linda for sharing briefly what their experience of getting the vaccine was like. Matt?
Thank you, Peggy, Linda, and Melody. And here we are halfway through our webinar. We're ready for, we are going to be joined by Dr. Lindsay Weaver. You know, we are very honored that Dr. Weaver could take time away from her busy schedule, you know, as the Chief Medical Officer for the Indiana Department of Health, a faculty member at the Indiana University School of Medicine. And I think, if I remember correctly, you're still practicing emergency medicine on a weekly basis. And so we are very glad to have you today to share your knowledge and expertise, Dr. Weaver. And I'm going to turn it over to you to share your presentation.
Yes, thank you everybody for having me this afternoon. I really appreciate the opportunity to give you an update on COVID-19. Thanks to you, all of you who submitted questions beforehand. I hope that I can address many of them during this presentation. Just give me 1 second while I get this set up. Okay. So I just wanted to take this opportunity to talk to you a little bit about where we are now, specifically about the Delta variant. And then I know people have questions about the potential for booster shots, also vaccine risks. You know, there's been a lot out recently over the last several months about the vaccines that we have available for COVID. So I wanted to take the time to really kind of let you know what are the risks and what are not the risks of getting the COVID vaccine. So these are our reports that we reported today on our website. This is from coronavirus.in.gov. If you are somebody who really likes numbers, I do encourage you to check out this website as well as rshot.in.gov, where we have information about vaccines. So unfortunately, we have seen an increase in the number of cases and in our positivity rate in Indiana over the last couple of weeks. And we do believe this is largely because of the Delta variant. So here you can see that we're reporting 497 cases today with a 6.1% positivity. Typically, the number we report on Mondays is a little bit lower than what we'll report tomorrow, just because less people tend to get tested over the weekend. So this is our map of our advisory levels for COVID. So this takes into account out of all the tests that are done in a county, how many of them are positive. It also looks at how many positive people there are in the county, per the county size. So it takes into how many people live in the county and how many of those people are positive. And then we combine those scores. So blue is on the good side. So, less number of cases, lower positivity, and it can get as high as red. So, early July, we had a lot of blue counties. So we were doing pretty well in Indiana. But like I said, over the last couple of weeks, we're seeing more yellow counties. And now we have some counties that are actually in orange. So a higher advisory there. And I'll talk a little bit more about what that actually means for us as individuals. This graph shows an increase in hospitalization. So you can see our highest number of hospitalizations for COVID was back in that November, December timeframe. And then it came down over the spring. We had another little blip in late spring. We had another increase, and now we are starting to see an increase again. So we are paying very close attention to that. I will tell you that by far, the vast majority of people who are being hospitalized are those people who are unvaccinated. And this is, comes to bear in the numbers, but also from personal experience. When people come in and they're very sick from COVID, the vast, vast majority are unvaccinated. So vaccines, we're still slowly chugging along in Indiana. We're so close to having 3 million Hoosiers fully vaccinated, and I really hope we see that number soon. So every day, vaccines are available all across the state of Indiana. You can call 211 and get set up to get vaccinated. They can help you schedule at a vaccine location. But if you are homebound, they will ask you a series of questions to assure that you are truly homebound, so that we can provide this resource to those who meet the qualifications. And then they will set you up with getting vaccinated at your home. So this was being done pretty much on a per county basis. So depending on what county you lived in is how we would set you up with home vaccines. But unfortunately, we saw the people who were providing those vaccines were, sometimes unavailable, or the schedule was just different per county. So we now have the Indiana Immunization Coalition is actually overseeing our homebound program and are providing those vaccines to people. So please, if you have yet to be vaccinated and you are interested, call 211 to get scheduled at a location nearest you. Or like I said, if you are homebound or your loved one is homebound, we can help get you set up with the vaccine there as well. And again, just calling 211. And they can also assist with transportation, by the way, if transportation is an issue when you call 211. So this is what our rate is here in Indiana per age group. So you can see that our older generation, definitely more people have received their vaccine. Which is great, because we saw by far and large the biggest risk factor for hospitalization and death was age. But that doesn't mean that younger people, especially if they have medical conditions or are disabled, aren't at risk of getting sick, because they absolutely are. So we are working as hard as we can to try to convince these younger age groups to go ahead and get vaccinated. Right now, the vaccine is still under an emergency use authorization. The reason for this, people have asked, why is it still under emergency use authorization? In order to move to a full authorization from the FDA has to see a certain amount of data. So they are actually in the process of reviewing all of that data that Pfizer has collected over the past year. I will tell you, these are the most studied vaccines out of any vaccine that we've ever had before, just because of the sheer number of people that have received them and how really wonderful our systems are at collecting information about these vaccines. So they have lots and lots and lots of data to review. We really do hope that that full authorization, at least for Pfizer, and the other ones will follow, will be here in the next couple of months. This map shows how the percentage of people vaccinated per zip code. So the darker blue is higher vaccine rates, and the darker orange are lower vaccine rates. And the kind of white gray color are those that are in the middle. So we have this available for people if they're interested, how your zip code, exactly where you live, how it is doing compared to the other zip codes around you or across the state. This slide specifically addresses breakthrough cases. So the point of the vaccine was not to completely 100% not have any cases, just like other vaccines that we get. You know, when you get the flu vaccine, that you still may get the flu, but you're most likely going to have a mild case instead of getting very sick, having to be hospitalized and die. So we do expect for there to be some breakthrough cases, but the primary goal of these vaccines are to reduce hospitalizations and deaths, and they are doing a tremendous job. So that big gray circle in the middle are how many people who are fully vaccinated, and these little bitty dots to the right here are how many people. The big blue one is how many people have had breakthrough cases. The little tiny green one is how many people have had hospitalizations, and the little red one is how many breakthrough deaths there have been. So a very, very, very small number compared to the almost 3 million people who have been vaccinated. So basically, these vaccines work. These graphs also show you some information about how well the vaccines work, and some more information about breakthrough cases. So if you look here this is cases per 100,000, and here is deaths per 100,000. The bottom line is people who have been vaccinated, and these top lines are people who have not. So you can see that your likelihood of getting the case or dying from COVID is much higher if you are not vaccinated. Unfortunately, the Delta variant, as I mentioned, has taken over as the predominant variant across the United States, but also here in the US. Here in Indiana. The reason I say unfortunately is that we do know that this variant is more transmissible. So you're much more likely to catch this variant than you were other variants, or you were from the original wild type of COVID-19. So basically it spreads very fast and very easy. And we're seeing that with our increase in cases. Just to give you some information about how we find out whether or not a case is a variant, is we get information from our labs across the state. We tried to test as many positives as possible, but depending on the test that you get, your test may not be sequenced. So for example, antigen tests aren't sequenced, not all PCR tests are sequenced, but we do get a high number of results on positive tests every single week. And then we sequence them here in our lab, or other labs across the state who sequence them give that information to us. So these numbers that you see here on this graph, this is out of 100%. So out of all the tests that we received that were positive, almost 81% of them were positive for the Delta variant. 8.2% was that original wild type of COVID-19, 7.3% for the Alpha variant, and that's the one that came out of Great Britain, if you can remember, 3.6% for the Gamma variant. So once you've had COVID, the fact that you have the Delta variant we do not believe it is leading to more severe illness, but we do know it leads to more infections. And so therefore, when you have a lot more infections, we do expect to see an increase in hospitalizations. So booster shots, and will we need them? The ACIP, which is basically with the CDC, their Committee of Immunization Practices, the ones who oversee all this data and make recommendations as far as the vaccines go, have now actually met twice on it. And they still say there's no evidence to support giving a booster shot at this time. They will continue to monitor the data to see if it is needed. It has been suggested that before they would recommend a booster to everybody, they may recommend boosters to people who are immunocompromised, or if, and hopefully not, there is a variant that the the vaccines don't cover, then we may need a booster shot. But that is not the case right now. The vaccines are covering these variants, and you are getting protected from these variants when you get the vaccine, especially from the severe outcomes that I talked about. They also talked about, can you mix and match vaccines? And people unfortunately did it accidentally. So if you happen to get a Pfizer and then a Moderna, you're okay. So as I mentioned before, they do worry, or they did say that people who are immunocompromised, for example, who maybe someone who has received a transplant, someone who's on hemodialysis, someone who's on chemotherapy, or an immunocompromised for another reason, may need to get boosters. But right now there is no recommendation to do that. It's just something that they're going to continue to monitor very carefully. So the exciting news from all of this is that means, since they're not recommending boosters yet, that these vaccines are continuing to work for a long time for us. The fact that they have such high efficacy, so they work so well right off the gate, and you can see that here in this slide on the right, means that they will last longer. So maybe even as long as 2 years. And so we're going to continue to monitor this data very closely. And this is the same slide saying the better the vaccines are in the beginning, the more likely they are to last for a long time. And that's what this graph shows you. Over time, how long is it going to last you, or how long is going to have that high efficacy? And you can see that when you already start with the high efficacy at like 95%, that you continue to be protected for a longer period of time. So what about some of the things that we've heard about these vaccines? So for example, myocarditis. So they did find a correlation between myocarditis and the mRNA vaccines. But as you can see from this graph, so all these blue lines on the left is your risk for hospitalization. And these red lines on the right are your risks for myocarditis. So myocarditis is an inflammation of the heart. It is typically very treatable. It is still very rare. It's something that happens that people can get. And typically it is found in younger men, which you can see here, a little bit more likely to have it when you are younger. And it's supportive care. So most people do very well. They don't even have to come into the hospital for it, but it is associated with these vaccines. But you can see that the fact that you're going to be much more protected from getting hospitalized from COVID and from dying from COVID than you are to ever get a case of myocarditis. So every medication that any of us take, any vaccine that we've ever taken has had risks such as this, and some with much higher risks, but they're just not as highly publicized as these vaccines have been. So a little bit more information about the Pfizer and the Moderna. So most side effects happen within the first 7 days, and those are totally expected. That's the arm ache, soreness, that's the muscle aches, that is fever, sometimes people have a little bit of GI upset, and those are all expected, and that says that the vaccine is working for you. So fever, chills, tiredness, headache, and typically more common after that second dose. And you can be happy when you have those to say, hey, the vaccine's working, my body's making an immune response so that when I'm exposed to COVID, I'll be protected. But do have this very small, rare risk of the myocarditis, mostly in younger males is where we see that, but still highly recommended for people to get vaccinated in all of these age groups, because the risk of COVID is worse and higher. So this graph is, again, looking at mRNA doses. It just kind of splits it between females and males, because you can see here the risk of myocarditis is very low for females, a little bit higher for males, but still much less than your risk for hospitalization from COVID. So what about the Johnson & Johnson vaccine? So as a reminder, that's the 1-dose shot. Again, most side effects happen in the first 7 days. And they have also found very rare occurrences of something they call thrombosis or thrombocytopenia. And that's when the factors in your blood that makes your blood clot actually get very small, but yet you still get a clot. So it's kind of this scenario where your clotting factors are low, but you still have a clot. And also something called Guillain-Barré syndrome, which is a neurologic syndrome, which makes it, typically it's temporary in people in most cases, but it can be very serious. So again, very, very rare. For the TTS, or the thrombosis and thrombocytopenia, 7 people out of 1 million, so women, this is just looking at women, because a little bit more often happens in women, a rate of 7 per 1 million women between the ages of 18 and 49. So if you're over 49 and you're a man, then definitely not something you have to worry about. If you're over 49 and a woman, not something you have to worry about. If you're a man at all, actually not something you need to worry about. But it very, 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 very small risk. But again, the benefits of the vaccine way outweigh this risk. And again, this graph, so the things on the right show you your risks, and over here it shows you the benefit. So if for 1 million doses given, these are all, the light blue is all the hospitalizations that will be prevented, and the dark blue are all the deaths that will be prevented, as compared to the very, very small risk of these rare outcomes and side effects from these vaccines. So you can see, I mean, especially in these older age groups, just how many hospitalizations and deaths are prevented by getting vaccinated, but also in the younger age groups. So people with medical conditions, should you get vaccinated? Absolutely. We know that you're at higher risk from the bad outcomes from COVID, hospitalization and death. They did include people with immunocompromised conditions, including HIV, in the trials, and really all medical conditions, high blood pressure, diabetes, people with disabilities. So if you're interested to look at those numbers, all that is available on the CDC website and also on the Pfizer, Moderna, and J&J website. But those people were included in the trials, and we know that the vaccine is safe and effective for them. I would say the exception are people who are immunocompromised, especially people who, for example, have had a solid organ transplant. They are unfortunately, the vaccines are not as effective in them. Again, not surprising, because they are, same thing happens unfortunately with other vaccines and other treatments for them as well. And also we know that older people, the vaccines aren't quite as effective, still effective, but not quite as effective. So all that being said, I talked a lot about the variants earlier. And my recommendation is that if you are immunocompromised, if you are older, that you do take precaution, again, with this increase with the Delta variants. You know, wear your mask if you're in a very crowded place, or maybe even better, avoid a really crowded place. And I'm not saying just not go out and do things, not meet with your family, nothing like that, but just maybe avoid that super tight, crowded indoor concert, right? That might not be the best place for you right now because you're immunocompromised or because you're older. Still remember to wash your hands and do those things. And, that's just my recommendation to fully protect yourself. But the vaccines do work really well with those exceptions. This is one question that we get quite a lot, is does it affect fertility? No, the vaccines don't affect your fertility. No vaccine that we've ever had has affected fertility. But I have found out that this is often a tactic that people who are against vaccines use to try to convince people not to get vaccinated. So it is definitely out there, and we know it's very prevalent on social media, but there's absolutely zero scientific evidence to support that claim. So really, you're at higher risk for complications when you are pregnant. So go ahead and get vaccinated if you're thinking about, having a baby someday. And encourage your friends and family maybe who bring that up with that same information. The other thing I heard was, does it change my DNA? No, the vaccines do not change your DNA. That is not how they work. All right, those were my slides I wanted to get through, and I hope I left some time for questions.
Thank you, Dr. Weaver. I think you answered. I was going through our submitted questions and checking off which ones you've answered. And so I think you've covered a majority of them, but let me go ahead and just throw out some questions at you. And this is kind of on the spot. We didn't give you much time to look at them. So let me start with this one. Will they be making vaccines available at doctors' offices in the near future?
So vaccines are available at doctors' offices, but unfortunately not all of them. And that is not because we are more than happy to get the vaccine to them. They just have not, either, I don't know, but have, for whatever reason, haven't decided to bring the vaccine into their office. So we're doing whatever we can to make it as easy as possible. But there are lots of providers who already have it in their office. So I do encourage you to call and see if they have it available. Some of them are only offering it like 1 day a week, because they have 10 doses per vial or 5 doses per vial. So they want to make sure they can get as many of those vaccines in people in that time period. Because, once you start using that vial, you have a short time to use it, just really within the work day. So I do encourage you to call. And if they say, no, we don't have it, ask why not. Say the Department of Health wants you to have the vaccine, so they're more than we're more than happy to take phone calls and get people set up with getting vaccines right away.
Great, thank you. Here's another question. I have received the Johnson & Johnson vaccine in early spring. Could I get the 2-dose vaccine now because of the Delta variant?
So that is not recommended at that time, but I will tell you it has been a part of the discussion because the Johnson & Johnson vaccine has a slightly lower effectiveness, but really is still highly effective, 90% against severe illness. So it's not being recommended at this time, but something that they have discussed.
Great. And you really talked about the vaccine adverse effects. We received a couple of questions. Is there an antidote for any complications to the vaccine? And I think you covered that. Those are kind of expected side effects. And then you talked about the there's no impact on getting vaccinated on your DNA with getting vaccinated. And so how about this question here is, what can we do to reduce misinformation about COVID and the vaccines, especially since people with disabilities can be vulnerable and can be given wrong information?
Yeah, that's a great question. So, we have done some, I guess you'd even call it marketing research. So just asking people, what are you looking for? What do you need to hear to help you, make a decision? And what we've heard right now is big campaigns and, social media and all that stuff isn't really what people at this point are looking for. So the people who are on the fence are really looking to talk to their trusted loved ones or their trusted, physician. So, if you have a friend or family who is asking what you think about the vaccine, we have tons of information on ourshot.in.gov, FAQs, and we include a lot of the misinformation out there, like I said, about fertility, about DNA, the ingredients in the vaccine, does it make you magnetic, and all that information is on the CDC website too. So I would tell them, don't listen to the poster on Facebook, go to the reputable sources of information. So our website or the CDC website. But I will say, like, you guys started with, 2 people talking about their vaccine story. And really, I think that is the most powerful right now. People want to know why are people making this decision for themselves, especially people who they, who they identify with, someone, a peer, a colleague, a friend, someone that they trust. Why did they get the vaccine? I think that's what people are looking to hear right now.
Great. And I'm pretty sure you covered this, but with all that I've been hearing about the variants, should I go back to wearing a mask even though I'm fully vaccinated?
So I will tell you that I have advised my at-risk relatives. So, not at-risk relatives by any means, but to be cautious again, right? So again, wear a mask indoors, especially if it's really crowded, and just to start thinking again, kind of about their situation. Now, for other people who are blessed to not be immunocompromised or are not older, I think everyone is aware of the risks these days. So, that there's been an increase in cases, there's some breakthrough cases, but very, very minimal. So you kind of have to do that risk assessment yourself. Now, if you're unvaccinated, you should be wearing a mask. Absolutely, 100% avoiding crowded situations. You're at high risk with this highly transmissible variant right now.
And that kind of leads into this next question. What would you recommend if one of my specialist doctor recommends that I don't get the vaccine at this time? So
that's so interesting to me. I really, I want to say there's no contraindications to getting this vaccine. I don't know of one. So I think I would really ask your provider, like what their concern is and what the worry is, and maybe even get a second opinion. Because, I'm not sure. But if there is a legitimate reason, maybe it's a certain medication you're on, where they don't think you would get an immune response. And so they're waiting until you're off that medicine so you can get the proper immune response, is really the only case I've ever heard of that. When that was on a specific chemotherapy medication. And really it wasn't a don't get the vaccine. It was just like a let's wait so you can like get the best immune response as possible. But if you're unvaccinated, wear your mask, avoid high risk situations.
And then what kind of impact has state lotteries like they did in Ohio, what kind of impact has that had, or other incentives had on vaccination rates? Is that something Indiana's considering?
So unfortunately, they have not seen, and there's actually data and there's articles out there. They did not see that great of an impact from the lotteries and the other incentive programs. Because if they worked, I think everybody would be doing them because we want to get people vaccinated. I think right now, people, everybody has who's left who are still unvaccinated has different reasons and different motivations. So it's really meeting them where they're at.
Great, and I'm going to jump here to our Q&A. And you've already covered the vaccine, safety of the vaccine for pregnant women. Can you talk a little bit about what it's looking like, the vaccinations being available to children under 12?
Yeah, so I just read an article just this afternoon, and honestly, we kind of thought this was the issue because they were saying early fall, and then they were saying, okay, maybe early winter, like November, December, maybe even January, February. And it looks like the FDA is asking for them to collect more information. So when they say collect more information, that's enrolling more people into their trials and then following those kiddos for a little bit longer of time. So I still think we're probably in that like late winter, but most likely like midwinter, so January, late December, that time frame.
Great. Any closing thoughts, Dr. Weaver? We've reached the point where we're going to stop our Q&A. I know that probably people have a lot more questions. And any final thoughts before you leave us today?
Nope, I just thank you so much. I really appreciate this opportunity. If you have been vaccinated, and I'm speaking to the choir, please go out there and be a vaccine ambassador. It really does make a difference. We all have personal stories where we have talked to our friends or families, or maybe someone in the, at church or wherever, and talk to them about vaccines. So, I mean, that is really the only thing we have to combat COVID right now. And then otherwise, just, from an ED doctor, be safe out there.
Great. Thank you for joining us today. And as we come to the close of our webinar, I wanted to once again thank Melody and Linda and Dr. Weaver for joining us today. Melody and Linda, thank you for sharing your vaccination story, about why you got vaccinated, and kind of addressing some of those concerns that people might have. And also I wanted to ask attendees today, as you exit the webinar today, either on your own or as we close out the webinar, you will be presented with a feedback form. And if you could, we would appreciate your feedback. Fill out the survey. And this is a great opportunity for us to get some feedback on some of the upcoming issues you would like for us to discuss, because we will be having a few more of these webinars throughout the remainder of the summer and into the fall. I just wanted to refer you back to what Dr. J. Lee mentioned early on, that we have a lot of materials that we've been developing at the Center for Health Equity at the Indiana Institute on Disability and Community, materials, fact sheets, and infographics about, why people should be getting vaccinated. These are materials that have been designed with people with disabilities and family caregivers, and we would appreciate, feel free to share them with people in your community, within your networks. We'll post the link in our chat feature that should be available, but also doing a web search for the Center for Health Equity at Indiana University will bring you to our webpage and to our Facebook. We've been building a resource list that's has a lot of materials that Dr. Weaver alluded to from the CDC, as well as videos talking about the getting vaccinated. And then I would also like to mention that on our Facebook, we would appreciate if you could follow us. We've been sharing throughout the months of May and June, we've been sharing people's vaccination stories, why they got vaccinated, what concerns that they have before they got vaccinated, what are they doing now that they are fully vaccinated in their community. So we would invite you to go and check those out and give us any feedback that you would like. As I mentioned, we are the Center for Health Equity at the Indiana Institute on Disability and Community here at Indiana University, and we are available. You can contact us through our website. And I would also like to say that a couple of people asked about for specific research studies that have been, that talk about the research studies that have been conducted or have been reported on the implications of COVID-19 for people with disabilities. And please feel free to contact us. We actually just did a summary report on the research available here a month or so ago. We would be happy to share that with you. And so as we come up on the hour, I would like to ask my colleague Dawn, who has been the technical producer of this, if there was anything else we should cover before we let folks go.
Nope, we're all good. Thank you, Matt.
Great. And we will be ending the webinar. Thank you for joining us today on the anniversary of the Americans with Disabilities Act.